Checking up on the pandemic and the recent regulations by the CDC, we have got Steve Martin. He's, of course, Ohio Northern University's professor and dean of pharmacy. And thanks for joining us, Steve.
Good morning, Holly.
All right, so let's talk about it. The CDC has now just changed some guidelines when it comes to safety measures. Can you explain it a little bit more and tell us more about that?
Yeah, I think what they've done is just given us more information. It hasn't really been a change per se, but they're giving us a lot more information. So up until this point, they have coded the counties in terms of the number of cases per 100,000 people. And, we would be graded as either low, medium, or high risk for transmission of COVID. That still remains, but what they've done is they've added a little bit more information to the mix, and they're providing the new cases per 100,000 over the past 7 days, and they're providing information about the new number of hospital admissions per 100,000 over that 7-day period. So what they're doing is looking at all three of those pieces of information together, and that's how they identify the different community levels, low, medium, and high, that we're looking at today.
I think what you keep hearing from everyone is, though, we can ditch the mask. You don't have to wear a mask. I mean, is that the big takeaway from this, or should we still be leery and wear masks? What do you think?
Well, I think that the CDC is trying to give us good information about when we can take the masks off, right? And we've been told that when we have high levels of transmission in the county, we should really wear masks and be very protective. And we're down, at least in Allen County and in Hardin County now, we're down into that medium area. And so that's a clue to us that it's probably safe to take off masks for people who are vaccinated or who have very low risk if they should develop COVID, but to remain masked for those people who are unvaccinated or who are at higher risks if they were to become infected with COVID.
I think that's a good point, because everybody just thinks everyone for a mask, but it does matter if you're vaccinated or not.
It does. The vaccines really are very effective in preventing infection, yes, but perhaps even more so in preventing serious illness or hospitalization. And that's really what we look at for the vaccine effectiveness. So those are very effective. So if you are vaccinated and there's lower risk of transmission in the area, that's where taking off the mask is probably okay. But there are a number of individuals who are at still high risk should they become infected with COVID, and also those who are unvaccinated who are at higher risk for infection. It just makes smart sense to keep a mask on in those situations.
What have we been seeing locally? Cases are down, right? But what about the request for a vaccine? Is there a correlation there, or?
Yeah, we've seen both a decline in the number of cases in our region, and also here at our pharmacy, we've seen a decline in the number of requests for vaccinations. For many months, we had been doing everyday vaccine clinics, and we discontinued that a few weeks ago because there just wasn't the demand for it anymore. That doesn't mean that people can't still come out and get vaccines, and I would recommend for anyone who's not vaccinated that they begin that vaccine series. Again, what the CDC has talked about is a layered approach in which we can provide a number of different preventative steps, vaccines, masks when necessary, and then even more of the social distancing and things that we saw before if we were to get to a higher level again. So I think the vaccines still are really the foundation for providing good protection against COVID.
Okay, let's look into your crystal ball. That's what I'm going to ask you to do. So do you think we are close to the end of this now, or do we worry about another variant coming out? What are we looking at in the crystal ball?
Boy, it's hard to say. I mean, we look here in the United States, and we've definitely seen a decline in cases across the country. Many areas of the country now are in that medium category, and several are in low. However, in other parts of the world, COVID continues to rage on, particularly in Eastern Europe, certainly pockets within Europe and in Asia and down into Australia. We're seeing increases in cases. You've probably heard about a variant of the Omicron, the BA2 variant, which accounts for about 1 in 5 cases across the world now. So yes, let's enjoy this period of time in the United States when we've got a decline in cases, but let's also be vigilant because, again, across the world, we're seeing continued problems with the pandemic, in particular this new variant that everyone's keeping an eye on.
And we are a global world now. I mean, you like to think, well, it doesn't matter what's happening over there, but we have found that you do have to worry, or at least acknowledge what's happening in other parts of the world.
Well, you sure do. It seems like those variants can spread very rapidly around the world. And we saw this with Delta and then with Omicron. So, yes, again, let's be happy that we have a decline in cases here, but know that there is the possibility that we could see new variants. It's very likely we will see new variants here in the United States coming up in the future. The good news, at least the preliminary data that we see out of a couple of studies this week, are that the vaccines that we are giving here in the United States are very effective against this new BA.2 Omicron variant. So that, again, that's good news.
That is good news. Are we also, since we're coming into spring and summertime where we're outdoors more, opening the windows, is that maybe going to help us along too and maybe give us a longer period of good news?
One would hope so, right? If we look back at last year, though, it was really during the summer months that we began to see the uptick in the Delta variant. So although that makes intuitive sense, we get outside, we breathe fresh air, we open the windows. It's not necessarily the only solution to this, and probably we have to also be aware of what's going on around the world pandemic wise, and that's where masking may become something we need to do again in the future. We don't want to leave them off, but it is a very effective means to help prevent transmission of the infection.
Certainly is. Well, Steve, thank you very much for this update. A lot of great information and informing us what's happening, and thanks for joining us today.
Thanks, Holly.
All right, don't go away. New Edition continues in a moment.